Hello everyone, this is Dr. Divya and topic for today's discussion is diabetes. Diabetes is a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. Types of diabetes. Diabetes is classified into three types: type 1 diabetes, type 2 diabetes, and gestational diabetes. Currently, at least 1 out of 3 people will develop the disease in their lifetime. Type 1 diabetes, and this is also known as juvenile diabetes. This is usually diagnosed in children and young adults. Type 1 diabetes is when body's own immune system destroys the insulin producing cells of the pancreas, particularly the beta cells which produce insulin. Only 5% of people have this type of disease. And during this, body does not produce insulin and it is not preventable and there won't be any primary intervention. Symptoms of diabetes. Common symptoms of diabetes, which includes excessive thirst and appetite, increased urination, unusual weight loss or gain, fatigue, nausea, perhaps vomiting, blurred vision. In women, frequent vaginal infection. In men and women, yeast infections, dry mouth, slow healing sores or cuts, itching skin, especially in the groin or vaginal area. Coming to the type 2 diabetes, this is the most common form of diabetes, about 90% of cases. And this is used to be called adult onset or non-insulin dependent diabetes. In this case, a body produces insulin but does not use it properly, cause glucose does not move into the cell. They'll pile up in the bloodstream itself. Risk factors. Most common risk is through genetics, and a person have polycystic ovaries syndrome, which is irregular menses, and like races, Americans, Hispanics, and Asians, like whites, they have the more risk when compared to the others. And at the age of after the age of 45, they have increase in younger adult and children. And environmental factors like inactivity, weight gain, also one of the major risk factor. Third type is gestational diabetes mellitus. And this is having diabetic during pregnancy condition. And the major cause is overweight prior to the pregnancy. And most having gestational diabetes put you at risk for type 2 diabetes. Once giving birth to a baby at greater than 9 lbs also put you at risk for type 2 diabetes. Out of 18, every 100 pregnant female will develop gestational diabetes. When high blood glucose level in the mother that will brings extra glucose to the baby will cause baby to put on extra weight. And here is the most complications for uncontrolled diabetes. One is blindness, cause cardiovascular diseases, stroke, which cause heart attack, and loss of circulation in arms and legs will cause kidney damage and also cause nerve damage, and finally amputation. How to monitor your diabetes? And blood sugar level is classified into three ranges: normal, pre-diabetes, and diabetes. When the fasting blood sugar level ranges 70 to 100 milligram per dl, considered as normal, and post-meal blood sugar level ranges 70 to 140 milligram per dl is also considered as normal. When the fasting blood sugar levels ranges 101 to 125 milligram per dl and post-meal blood sugar level ranges 141 to 200 milligram per dl is termed as pre-diabetes. And the fasting blood sugar level ranges 125 milligram per dl and above, and post meal blood sugar level ranges 200 milligram per dl and above is considered as diabetes. How to prevent type 1 diabetes? It is not preventable as of right now, but studies on way to possible prevent further destruction of the beta cells. One should maintain and control sugar levels by taking insulin injection and lead a healthy lifestyle using exercise and diet. And also by transplantation of islets will prevent the type 1 diabetes. And prevention of type 2 diabetes, primary thing is to maintain a healthy lifestyle. Secondary thing is check glycosylated hemoglobin, according to that adjust our diet. And tertiarily exercise and eat well. And prevention of gestational diabetes through physical activity and maintaining a healthy diet. Researchers found being physically active before and after their pregnancy should reduce the risk of gestational diabetes of about 70% or more. And diet, a study showed that each 10-gram increase in fiber a day reduced the risk of gestational diabetes by 26%. And this is the reference. Thank you.